Hello, welcome to the Tossing Grenades at Windmills podcast. My name is Tom Ricks, and this is part of an 11-part series called How to Fix a Broken Everything. We're going to start with healthcare and go from there. So, too long didn't read version. There is an excellent documentary by Michael Moore called Sicko, which goes around the world and shows the best parts of other people's systems. And I think he has some really good ideas. I know a lot of people don't like Michael Moore, but frankly, this podcast isn't for most of those people because most of them are either centrists or liars. There are a few people that don't like his personality, and your mileage may vary. But the man does his homework. So I think that in a nutshell, if I was going to pick and choose other systems, I would probably choose the Swiss with a mixture of the German, where the Swiss actually do have insurance, but it's not for profit. And then I think the German model of some how they handle the state side of things. But I have some other more specific ideas on top of that, and I want to talk about two or three, because they also talk to the larger framework. Going back to the hierarchy of values that I talked about last time, the fact is that this is something that an organization can choose, right? There's an honest dialogue and a crazy dialogue. The honest dialogue is, do we as a party or as a people want lower cost healthcare versus more quality of care? Or do we want to make drugs cheap but only focus on the basics for hospitals and not allow elective surgery, or if you do, you have to pay for it? There's so many places for honest people to agree to disagree that I'm actually almost in favor of almost all of them. I would actually need to see a discussion in this country that was honest about healthcare, and it's just not happening. The progressives want to do Medicare for all, but the truth is that Medicare is not perfect either. I find on the map right now that socialism, especially democratic socialism, offers the best deal. Libertarians lie, conservatives lie, centrists not only lie, but they have no values. It's unbelievable, but centrists actually manage to have less values than conservatives who have none. So, I'm going to back the best game in town, which is the Democratic Socialists right now. But I think we can do better. And specifically, Medicare for All is a much better system than Obamacare, and it's certainly a better system than Trump care or Bush care or crap care that we have had for a long time. But, I'm not entirely convinced that even with Medicare for All, we're going to have an infrastructure that takes care of the truly ridiculous costs. Because with Medicare, you can still have for-profit insurance. It has it, right? Medicare does bulk negotiations for drug prices, so that would help bring it down. Medicare does bulk negotiations for things like hospitals, but the absolutely insane method that goes on. Look at Adam Ruins Everything for why things are so expensive at hospitals. That's a great source for that, and it's just ridiculous. It's absolutely criminal. My argument is, why only do the best of what everybody else is doing? I am a firm believer that if you're doing something truly radical, you should either do it in a small pilot program first, or you're better off choosing what has historically worked. Having said that, there are certain things that, to me, work in other models and other industries that we should seriously consider. And they are done in other countries, just not to the scale that I think we should. I think that we should have the federal government manufacture all generic drugs. We don't need to make new drugs illegal. We do need to shorten their patent life to just 7 years, like it is in the original Constitution, especially since, as much as I am in favor of a new Constitution, this entire series is about fixing what we can with our current system without having to reboot it. And we can easily have the government, just like the post office, manufacture at cost generic drugs, and we can even allow private enterprise and have other crappy companies try and sell these generic drugs under brand names. I'm really okay with that, because it will keep the free enterprise people, twiddling their thumbs, while anybody that has half a brain or any kind of organization helping them will get the at-cost generics without the drug companies being able to hobble generics manufacturers in crap deals. Another thing that occurs to me is that I think in particular necessary if we're going to go to more of a state healthcare system like what England or Canada has, which I think is very likely, and we're probably going to have some variation of it because I don't see the VA going away anytime soon. We need patient advocates. Now, this profession does exist, but when I say patient advocates, I mean that everyone in America should get, as part of their medical coverage, in addition to the doctor of their choice and the specialist of their choice, to the degree that people are willing to be that type of specialist, because we should not force, like Cuba, anyone to work in a field that they don't want to work in. Period. And nor should we force anyone to work where they don't want to work, i.e. government subsidization of rural areas, which I'll be talking about in another section. It just should only occur to the extent that people really genuinely want to do it. If people in rural areas actually stop trying to sabotage cities in every way, shape, or form, then maybe cities might want to help them out. In the meantime, I think there's some retaliation in order, which is also another one of these that we're going to do. But as far as the patient advocate is concerned, it's got to be somebody who is the equivalent of a nurse practitioner, but not trained as a nurse, but as well trained as a nurse, but somebody who does not spend 100% of their time working as a doctor or working as a nurse, because to be totally honest, some of them can be great and some of them are arrogant as shit. The fact of the matter is that just like in our legal system where you have a defense attorney, even more in terms of defending your body, you should have someone who is minimally, at best, ideally better trained to advocate for what you want. And so if you tell the doctor that you're in pain, this person will advocate for you and listen. And more importantly, they are going to get reprimanded in a way that's not just controlled by their peers for ignoring the wishes of their patients. Too many times in this country, doctors and nurses basically think that they know better than the patients. And you know what? Sometimes they do. Sometimes people want stupid stuff like to not vaccinate their children. But if you have a class of medical professionals who are specially trained in empathy and specially trained to know exactly how to talk to a doctor and get a doctor to listen to them, and more importantly, empowered so that if the doctor does not listen to them, they are in trouble. Your doctor should work for you and do what you want because you are paying them. Period. End of discussion.